Everyone, children, adults, their parents, they're all in one main room.
More times than she can count, Michelle Massey Barnes and her son have been in a crisis and forced to wait. At 15, Logan suffers from depression and anxiety, but when he needs psychiatric care, there's often nowhere to go but a hospital waiting room.
There are times when it is overflowing and you have no choice but to be directly next to people because there's nowhere else to go.
The wait is hours or sometimes days, and it's so common there's a name for it: psychiatric boarding. It was dangerous before COVID struck. Today, it's much worse.
Sometimes you can't maintain 2 feet of space because there just aren't enough chairs.
It was spreading pretty bad.
Until last month, Susan Mitchell was a nurse at Detroit's Stonecrest Hospital, one of the largest psychiatric hospitals in the state. Protecting patients from the virus, she said, often felt like a losing battle.
They depend on us, the workers, to keep them safe. And we didn't do that. We didn't social distance them. They were not masked unless they insisted that they wanted a mask.
COVID spreads in schools, in nursing homes, and in prisons, and the state regularly reports outbreaks in all of them. But if there's a COVID outbreak in a psychiatric hospital like the one behind me, well, the state keeps quiet. It's not because COVID doesn't spread here. Throughout Michigan, there have been outbreaks at both state-run and private psychiatric hospitals. The state tracks the information, but unlike with prisons, nursing homes, and schools, has chosen not to release it publicly.
It's the type of thing that the broad mental health community needs to hear about and know about.
For decades, Mark Reinstein has been one of the state's most prominent mental health advocates.
Too often, we tell people with mental illness, in effect, that you're not important. And this could be taken as another one of those messages.
Once it gets into a congregate care facility, it runs rampant. It's really tough to contain.
Dr. George Mellows is the Deputy Director for State Hospital Administration, overseeing Michigan's 5 state-run hospitals, including Kalamazoo Psychiatric Hospital, which just last month saw 63 staff members and 51 patients stricken with COVID-19. One of the infected patients died just this month.
So a third of the hospital was infected.
That's correct.
And while you'd know that if we were talking about a school or even a prison, you didn't hear about this outbreak because it happened in a psychiatric hospital.
None of us have seen what you had dug up. How long would it take to put it on a website?
The Michigan Department of Health and Human Services would not agree to an interview about why it's kept COVID outbreak data under wraps, but said in a statement that we post the information that we believe is most relevant and that is most requested by the public.
It's certainly very frustrating that this information isn't readily available and that we have to figure out how to navigate it on our own.
These are people too. These are people that we want to protect to the maximum degree possible.
Tonight, Stonecrest Hospital here in Detroit says that they follow all CDC protocols and give every new patient a face mask. Tonight, state health officials say that the number of COVID cases at Stonecrest and the more than 70 other psychiatric units across the state will remain a secret. We're in Detroit tonight. I'm Ross Jones, 7 Action News.